Joe Rogan discusses chiropractic care in the U.S.,
chiropractic medicine.
To learn how to crack babies' spines.
sparking a lot of conversation.
You say baby spines. I mean,
Oh,
some
babies.
people do it.
You're now at part 3,
Was a complete, total bullshit artist.
so be sure to watch the earlier segments for important context. The link should appear on the right side of your screen.
Which may also account for some of the pain
Yeah.
relief from chiropractic medicine.
Absolutely. I mean, they're doing
quotes, medicine.
Yeah, exactly. Like they're doing some massage along with what they're doing,
Right,
and some
that's
of them.
a problem because massage actually helps.
Yep.
Once again, we see Joe Rogan's biases regarding current scientific evidence on manual therapies, which include all approaches using hands to relieve pain, whether it's massage, mobilizations, spinal manipulations, or using a small hammer with a stake, as some chiropractors do in the US. All these techniques fall under manual therapy. The scientific evidence supporting them is very weak and inconclusive,
Massage actually helps.
so we don't really know what actually works. If Joe Rogan discusses these techniques, it's probably because they align with his personal therapeutic values. If he were to visit a clinic, offering him manual therapy might enhance the placebo effect, as he believes it works for him. This effect could be stronger than other interventions, like an adjustment, simply due to his expectations.
And there are studies that show people who go to a massage therapist or a massage practitioner tend to get more relief than people who go to a chiropractor.
Conversely, a person who comes in thinking an adjustment is necessary to unblock or realign something might be influenced by their own beliefs about what alleviates pain.
So please go to a massage therapist.
But let's remember, there is no solid scientific evidence to claim that one manual technique is superior to another for relieving the majority of musculoskeletal pain. Sometimes, small hints suggest benefits for certain techniques, but even then, the evidence remains weak and uncertain.
Those are your science-based practitioners. Chiropractic works kind of separately and on theories that have never been proven to work. They can't even do imaging. Like I believe something like half of chiropractic clinics don't even have x-rays.
There are several points to clarify here. First, chiropractors can indeed prescribe and analyze x-rays. However, that doesn't mean they necessarily need to have an x-ray machine in their clinic.
So how can they show you 100% for sure that what they're claiming is happening in your back?
It's essential to remember that the idea of subluxation displacements has no scientific basis, so this concept wouldn't show up on an x-ray. I understand the reasoning that might lead some practitioners, especially those adhering to traditional chiropractic theories, to systematically use x-rays to locate imaginary subluxations. In this purist view, it might make sense for them to take x-rays to identify these so-called subluxations, even though it is ultimately pointless. Additionally, some chiropractors controversially claim they can detect these subluxations through palpation or with tools like the nervoscope, which also lack scientific grounding. In Canada, chiropractors have the option of having an X-ray center or making external referrals. However, X-rays should only be used when specific symptoms and a clinical history justify it, aiming to confirm or rule out significant differential diagnoses. On the other hand, routine or screening X-rays provide no benefit to the patient. Taking X-rays merely to inflate the bill or to make alarmist comments about spinal health can lead to prolonged and often unnecessary treatments for patients.
About half of chiropractors do the bullshit stuff. They do the extraneous wellness stuff. So
one of the reasons I often adopt this discourse in Canada, Quebec, and France, where we also produce content in French, is because I always aim to direct people towards practitioners regulated by a professional order.
if you're playing Russian roulette and you have a 50% chance of getting a bullshit or getting a bullet, are you going to do that? No. I don't want a 50% chance of having a bullshit doctor.
These organizations standardize not only clinical practices, but also the profession's discourse. In Canada and Quebec, the only practitioners authorized to work on the musculoskeletal system and make diagnoses in this context are doctors of chiropractic and physiotherapists.
Well, maybe your cold's really a germ and, maybe it's Ebola. I don't want the bullshit doctor. I want the guy who knows what he's talking about.
Chiropractors undergo 5 years of university training, earning a first-degree doctorate, which allows us to use the title of doctor as healthcare professionals. Physiotherapists are also well-trained to manage neuro-musculoskeletal pain.
And this is what you're getting with chiropractic. You're getting a bullshit doctor.
In the United States, however, I strongly recommend consulting a physiotherapist for clear and reliable information about pain.
And it's even if
But
you're...
it's not a doctor.
Yeah,
Isn't
exactly.
this part of the problem? Is
Yeah.
that they call themselves
Like,
doctors?
have you
I
seen-
didn't know.
Other professions are less regulated, making them more susceptible to spreading pseudoscientific concepts without real oversight or consequences. The problem in the United States is exacerbated by a freedom of speech often misapplied in healthcare. We see medical doctors and other health professionals making questionable claims, often to sell supplements or so-called miracle treatments.
Today I want to share the best supplements for very specific health conditions. And I think everyone should really know this information because sooner or later you might end up with one of these problems, and it'd be nice to know a remedy that could help you, especially if you're not into taking drugs. A remedy.
In the United States, it's the Wild West of information.
What's the connection between the spine and Crohn's? I thought it was inflammation in the intestines. So your spine, specifically from T5 to L2, innervates your intestines as well as your stomach, so your GI system. And a problem in this area can lead to a problem in the intestines, a problem in the stomach.
In a context where chiropractic is still resistant to change, I recommend consulting either a physiotherapist or a chiropractor whose discourse is fact-based and who knows how to distance themselves from the stereotypes of their profession. Look for a practitioner who can clearly explain their interventions and use tools that make sense to you, but a massage therapist may also be a valid option. The U.S. is unique when it comes to conservative care, and it's essential to be well-informed to avoid falling into the traps of pseudoscientific discourse.
This is going to be a fun story. By fun, I mean horrifying. One of the guys I went to undergrad with went to Palmer Chiropractic College. Now, the acceptance rate, 100%. Tuition, $34,000 a year to learn how to crack babies' spines.
When it comes to babies, as I mentioned at the beginning of my videos, I earned my doctorate at Palmer College of Chiropractic. During my training at Palmer, we were never taught to manipulate babies' necks.
Some
Babies.
people do it.
We had a rather awkward workshop using dolls to demonstrate certain techniques, but personally, I stayed away from it.
Now, it is a growing field in chiropractic.
Yeah, this
I find it hard to conceive the idea of manipulating a baby's neck. First, because babies' vertebrae are primarily made of cartilage, giving them a significant natural mobility.
is hilarious. He said, "You're saying they crack baby spines. It's a gentle manipulation." I'm like, why?
And when we say that the adjustment is so gentle that it won't cause any issues,
Why?
we might ask, if it's that gentle, does it really have an effect beyond the placebo?
Yeah, exactly.
Here's the thing. Why? Why
Yeah.
the fuck are you manipulating babies?
No.
There's no evidence whatsoever that that helps babies.
and this is-
the babies aren't complaining about back pain.
The child might just feel the pressure, a tension on a specific area, but that doesn't necessarily indicate clinical improvement.
Yeah, no, here are the two things that I've heard. One is that it's so gentle, it wouldn't even bruise a tomato skin. Then why are you doing it?
In my practice, the only reasons to consider bringing a child to a chiropractor or physiotherapist would be for pediatric pseudotorticollis. This condition can manifest at birth as a small lump on the sternocleidomastoid, the muscle on each side of the neck, often due to a mass of connective tissue. This condition might hinder the baby from turning their head or feeding. In these cases, gentle chiropractic or physiotherapy treatments, like light mobilizations, manual therapy with small traction movements, or techniques such as pin and stretch, can be helpful, combined with exercises that parents can do at home. This reassures parents, gives them tools to better manage the situation, and makes this phase less stressful for them. It's important to note that, according to the literature, pediatric pseudotorticollis often resolves on its own over time, without specific intervention. Studies generally indicate that this can take a few weeks to a few months, but it is a condition that naturally resolves.
Why? No, the other thing they say
Because
is
it's bullshit.
Yeah, it's because they can charge parents.
For the rest, in the history of chiropractic, there are anecdotes about the impact of chiropractic care on colic, ear infections, and other pediatric issues.
This infuriates me so much.
However, it is crucial to remember that these are just anecdotes. Currently, there isn't enough evidence to justify this type of treatment for these conditions. That's why, in Canada, we completely avoid adopting this unfounded discourse.
From manipulating the spine, because the spine has, within those bones, they have the spinal column, and the nerves control everything in the body.
Regarding bringing babies for psychomotor or motor development reasons, there is virtually no evidence supporting the long-term benefits of chiropractic care on children for this type of development. From what I have reviewed, there is no clear evidence on this matter. Without solid evidence, it wouldn't be appropriate to make general recommendations for routine visits to chiropractors, osteopaths, or even physiotherapists for babies, especially in the absence of a specific issue. It is also important not to imply to parents that there is a significant benefit or advantage to conducting ongoing preventive consultations for a child who has no health issues. Claiming that one could improve their development without evidence to support it would be misleading. It may be hard for some practitioners to hear, but without concrete evidence, we must exercise caution and be conservative in our discourse, both with patients and in our public communications.
And so from stimulating the nerves, you can give the infant all the immunity it needs to not need their vaccinations.
And we'll stop here. But if you're interested in what comes next, the link should be available in the meantime. Feel free to share your story, comments, suggestions, or if you still have questions.